So hypermobility is a concept that gets talked a lot about, but do you have it or how do you test it? So that's one reason why individualized programs are always more beneficial than a generalized program which is targeted for everyone. So an individualized program will notice if you have something like hypermobility, and if you're hypermobile or if you have increased joint motion or your ligaments are more lax, then that's going to affect your training. So there is a scale here you can see, which is commonly used to get an idea of your hypermobility or your overall mobility. So in the physical therapy setting, we always test range of motion with a goniometer, but this is a test that more than physical therapists can do and other people can utilize to get a general idea if someone is a little bit more lax. So you can see some of these tests here, and if you were going to pick a couple of them, some very easy ones to use are this one right here you can see, and you'll get a general idea if someone has more mobility. And then two other common ones to use are the touch the floor test and also the elbow hyperextension test. So this one's very commonly noticed during push-ups. I've noticed this a lot during that push-up challenge test that was going around. So if you have some of these tests that are positive, it's just something to consider. It doesn't mean you're more likely or guaranteed to get injured. It doesn't mean that you are unstable or have instability, because some people that have this hypermobility are very strong and have good dynamic stability throughout different exercises in their full range of motion. But it is something to consider. And if someone has this overly mobile joints in certain areas and they are at risk due to overloading and high volume training or sport training, then it is something to consider and make sure that they have good control of their full range of motion.